So I have a few tips that may help you get the most out of your procedure. And the first of those, I think, is to get educated about your procedure. Now, of course, that will be communication, with your surgeon and getting their explanation of, what's happening. But you do have to make sure that you understand it. I find that in many cases, patients may absorb some of what's being said, but because of the trauma of the situation, in many cases, not absorb all of it. So doing your research, getting the specific diagnosis, having having it written down for you, or even looking in, say, for example, Epic MyChart to see the specific diagnosis, and you can do your research. The next one is make sure when you're doing your research to do it on well-vetted sites like the American Academy of Orthopedic Surgery, American Society for Surgery of the Hand. These are sites where you're going to get information and it'll direct you to places that have well-vetted information. So you want to make sure the information that you're getting is good. You want to definitely establish good communication with your surgeon. One of the ways that I just mentioned, you can look up, usually there's an online portal for whatever electronic medical records you're using. But in that online portal, there's usually a way to communicate directly with your doctor. Now, of course, phone calls and other communication is fine, but I find that as a physician, it's very helpful when it comes directly through these portals because it's really flagged and directed in a way that makes sure that it gets the attention of the clinical staff. You also want to map out your post-op recovery. So you want to have an idea from your surgeon and from some of these sources exactly how long does it take to really recover. And that's one of the things, because you'll know whether you're on schedule or not. You'll know, if you need to speed things up or slow things down. And lastly, you want to travel the well traveled path, meaning you want to listen to your surgeon and the protocols that they've outlined. And the reason those protocols are there is because they're the ones that have been most successful in the past at providing good results. So, of course, not one size doesn't fit all, but in general, the steps and the gradients that we take, although some can go faster and some slower, ultimately, if you follow that path that many have traveled before, you'll find that you'll be successful. So, and just in doing these few things, you'll ensure that you get a good result from whatever procedure that you're going to have.